This procedure video will take you through the techniques for performing a lumbar puncture. As with most potential procedures, you may be asked to perform either part of the procedure or most of the procedure in the OSCE station. It may be that you're asked to explain the procedure to a medical student and explain the indications for performing a lumbar puncture in the emergency department. Again, a formal introduction, an explanation of the procedure, and obtaining of verbal consent is essential. This is of course a sterile procedure, and as such universal precautions are mandatory. Hand washing, the donning of sterile gloves and gowns must be undertaken and suggested to the examiner.
Now we're going to talk through how to do a lumbar puncture. Explain to the patient why this needs to be done and exactly what you're going to do. Make sure the patient is comfortable and understands this is very, very important. You lie them on their left lateral side with their back very close to the edge of the bed. Their knees bent up and their chin tucked in. It's often a good idea to also have a pillow underneath their head, and sometimes also to put a pillow between their legs will also help. So while they're in that position, warn them they'll be there for a good 5-10 minutes, and then start preparing your equipment. And now put on sterile gloves. And begin to prepare the patient. So with your gauze, start centrally in the area and start moving outwards. Discard it into a dirty area, and then take a second one and repeat. Let that dry, then find your drape and place it over the patient. Then palpate their posterior iliac crests, come down, and you'll find you'll be in the vertebral space between L3 and L4. You can either use this joint space or the joint space below. Get some of your local anaesthetic, 1%. Palpate the area. Some people very gently push in with a fingertip so you get a line in the area. Warn the patient. Retract and inject some local anaesthetic. While you're waiting for the anaesthetic to take effect, make sure you've set up your manometer. It can be quite useful to have a second person to help you, especially with all the bottles and with the manometer. Make sure that you check your manometer, that it's in all the correct positions so that you can just pick it up. Make sure that it's off to the patient initially so you don't lose any of the CSF. Loosen the top of your bottles. With your needle, with the bevel pointed upwards, find your previously marked position, warn the patient to keep nice and still, and that you're about to start. Then insert the needle, bevel up. You're aiming for a plane that's parallel to the patient, and you're aiming towards their umbilicus. Slowly insert the needle, aiming to go between the two vertebrae until you feel a sudden give. Once the needle's in the correct place, you should see a flashback. Gently remove the needle, and you should see CSF beginning to fill. Attach the manometer and watch as the CSF level begins to rise, and wait until that settles, and you should see some movement with respiration. Once you've then found your level, prepare one of your tubes. Make sure you open this. Gently remove the needle. And at the same time, with a piece of gauze, apply pressure over the top. Gently push on there for a while, then dress the area and leave the patient lying down flat for at least an hour while monitoring their blood pressure, their pulse. After that, sometimes simple analgesia can help with the headache, and make sure they've had enough fluids.
When performing a lumbar puncture, at least 3 samples in universal containers should be taken. It is important to send the first sample for assessment of glucose and protein levels, the second sample for gram stain and culture and sensitivity, and the third sample for a cell count and differential. You may well need to notify the microbiology technician on call that the samples are en route, as these samples will decay with time. It is the duty of the doctor who performed the lumbar puncture to chase the results from this technician. A post-lumbar puncture headache can occur in up to 1/3 of patients undertaking a lumbar puncture. Common sense management is to lie the patient flat for up to 1 to 2 hours and to ensure that analgesia is maximised. Hydration cannot be underestimated and intravenous fluids can be started.